Hope you will consider supporting my goal to have 1,999 subscribers by December. Thanks in advance! Please remember to like and subscribe. Got a request for some NCLEX questions, subjects, or topics? Just leave a comment or send a message to let us know. And without any further ado, let's get to it. This is part of our short NCLEX prep series called the 3-Minute Review. NCLEX Drugs Pharmacology revealed what you need to know about calcium channel blockers, also known as CCBs. The drug classification group calcium channel blockers and what you need to know. Well, what you need to know are the drug suffixes, which is also the ending. And they are either amyl, A-M-I-L, or pine, P-I-N-E. Those are the two most common and recognizable endings. This table is a classification of CCBs explained further. Please pause the video to save this table. It's very helpful. What it helps to know: mechanism of action, how it works. It disrupts or blocks the movement of calcium through calcium channels. It dilates the arteries to reduce pressure in the arteries. In other words, it opens up the arteries. Think of a club bouncer or security guard who decides who gets in and who stays out. And this is club channel. And calcium is not allowed entry. So calcium blocker or security guard or bouncer prevents calcium from entering through the entry. This is an excellent table to save, pause the video, and review. It shows you normal physiological role of calcium channels in vessels. Now what you must know are the outcome, the goal, purpose of use, what it does, why we give it. It lowers the blood pressure, treats chest pain, decreases excitability of heart muscles, treats cluster headaches, migraines, and irregular heartbeats, rhythms, also known as arrhythmias. The most common drugs are amlodipine, known as Norvasc, verapamil, known as Calin, nifedipine, known as Procardia, and diltiazem, known as Cardazyme. Now, a trick to remember the generic names of these calcium channel blockers is a very nice drug. For amlodipine, verapamil, nifedipine, diltiazem, a very nice drug. However, if you prefer to memorize the brand names, then use the mnemonic news channels play commercials. Norvasc, Cardazyme, Procardia, Calin, news channels play commercials. Pause the video and review the amlodipine versus nifedipine. It's quite helpful. This table will explain the blood pressure, and so you can understand how the calcium channel works in it. And this table will explain normal physiological role of calcium channels in heart. Please pause and review this. And this final table, you really need to keep, pause, review, screenshot, because it's a very detailed and visual explanation of what calcium channel blockers do. Now, if you were taking the NCLEX today and needed to know what calcium channel blockers do, also known as CCBs, they block calcium entry. Thus, the heart's contraction is not as forceful, relaxes blood vessels, reduces the heart rate, and lowers the blood pressure. And that's what calcium channel blockers do. And finally, this last table explains the classification of cardiovascular disease to help you with your NCLEX. And good luck! Please like and subscribe, and bye!